My name is Darrell Handwerger, a functional medicine practitioner and family nurse practitioner here at South Florida Integrative Health Center. And integrative medicine is really bringing together the best of both worlds, the world of integrative medicine, holistic medicine, and conventional medicine with the great diagnostics and laboratory markers that conventional medicine has, and understanding where the medications are working so we can use something more natural and more preventative to really support the systems from our understanding of biochemistry. So let's begin with why the gut is so important and why that's a foundation of good health. And so we're helping so many people here at South Florida Integrative Health Center get healthier. And our focus is at the foundation, that the core is rebuilding the gut. Gut health is a foundation. We've always known in holistic medicine, functional medicine, that you need to really work on the gut. Gut health is extremely essential for the immune system's status of health. For example, 70% of the immune system is in the gut. So obviously, the gut is going to be a major player when we're talking about autoimmune conditions and immune systems that are just gone haywire and are attacking their own self, which means autoimmune when the immune system doesn't recognize its own self. So this disconnect many times begins in the gut. So we want to really address gut health because the gut has to be permeable and selective to allow vitamins and nutrients in, but it has to be selective and not allow these toxins and larger particles in, because these larger particles of food can trigger our immune system, because many of these particles of food are very similar to molecules or to substances in our bodies that are very similar, even on a DNA level. And that's what triggers our immune system when these proteins get through our gut, because our gut is less selective. So it is so important to really rebuild the gut and repair the gut. And we've developed gut testing over the years to be very effective. There was a time when these tests were very helpful, but not as clinically useful as they are today. So, in the past, we always knew there were these food sensitivity tests. Now, when we know about the microbiome, many functional medicine practitioners, including myself, do not go for food sensitivities at the beginning. We work on rebuilding the gut first. And that has been a major development because IgG food sensitivity testing was a big thing. And now, really, the essential step is to fix the gut and have more thorough testing, much more than IgG. There's complement pathways of inflammation where food sensitivity tests can become more effective. But right now, the major area to focus on is the gut microbiome. So rebuilding the gut is the foundation of good health, and a very good stool test. See, the gut testing is going to be either a breath test coming from the small intestines or a stool test, which is more going to assess the large intestines. So the test that we use is a DNA PCR test because we really want to pinpoint the species that we know, even though there's going to be thousands of more species investigated and researched in the future. We know that there's species now that produce these very important metabolites known as short chain fatty acids that are extremely important to healing the gut, preventing colon cancer. For example, butyrate in the research is a major player for preventing colon cancer. It's a major player for brain health, brain-derived neurotropic factor. So this substance, butyrate, is produced by a good microbiome, keystone species that we want to look for on a very specific, very accurate test. And those are our DNA PCR tests of today. The old test, you should just look at a standard of a generally healthy population and how a person's diversity, for example, compares to a general healthy population. That's good, but not good enough. It's not good enough for individualized, personalized nutrition, personalized medicine. Each stool test that we do is different for each person. They have different enzymes that are picked up, whether their pancreatic enzymes are sufficient. They have different antibodies to gluten, for example, to a food that their immune system is reacting to. We see that they're not digesting fats, so that shows liver and gallbladder health connected with the gut. We see an enzyme in the gut that tells us about phase 2 detoxification, known as beta glucuronidase. We have a lot of things we can learn from a very advanced gut microbiome test about intestinal health, digestion of fats, fat soluble vitamins, and gut microbiome, a healthy diversity. But also these keystone species are going to help us with B vitamins, biotin, vitamin K, vitamin D. These vitamins rely on a healthy gut microbiome. So we often, on our patients here at South Florida Integrative Health Center, go really in depth on rebuilding their gut so we could help their immune system, help them control inflammation, help really absorb nutrients much better, absorb foods better. Their protein is able to break down and be more improved. Digestion improves, skin improves, metabolic conditions improve. And that is really the name of the game with chronic disease, is to fix the gut first. So if you have any questions, reach out to us at South Florida Integrative Health Center. Our website is there on the screen. You could drop us a note or a comment, and we are here to help. We are doing this GI stool test and helping people rebuild their gut. You could ask us how we can help you. Have